Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and greetings to everybody. I'm Haslinda binti Husaini. I'm going to present the title of Library Therapeutic Landscape Support for COVID-19 Pandemic Related Student Wellbeing in Academic Libraries. So the team members for this study or research consists of me, Haslinda Husaini, and Professor Mada, Dr. Shamila Mohamed Shuhidan, Puan Suriana Daud, and also Dr. Fajar Priyanto from Universitas of Gadjah, Mada. So this is the outline of my presentation. We will have the introduction, and then we are going to explain related to the problem statement, library therapeutic landscape, and also related to the student social well-being. So this paper actually is funded by UiTM under the grant Lestari COVID-19. So this paper actually investigates the influence of the academic libraries therapeutic landscape on student social well-being. So the current COVID-19 pandemic actually has interested the whole world in changing the habits and also use of places and cities. In the lockdown period, cities and public spaces become completely empty, and new urban landscape substitute the previous one, transforming the private in public. So the reopening of all the public spaces happened after years of closure. So this allow again in present social interaction, although in respect of the physical distance, confirming the importance of these places for all people. Okay, this is actually the facts about COVID-19 in Malaysia. We have seen the movement control order by all the phases. And then it's also happened the closure of the university also, or the academic libraries, including also the UiTM libraries also have to be closed during the movement control order. So Malaysia actually is not immune to the current global financial crisis brought by the COVID-19 epidemic or other social and political challenges that have emerged. So regarding Husaini, Nordin, and also Shamila Shuhidan at 2018 and 2019, adopting the notion of therapeutic landscape in a public library has become essential for meeting the perception and also the expectation of library users to combat the daily pressures of modern society. So library play a role in changing and also helping to improve the quality of lifestyle of the community. So the transformation of library is able to transform the society. So this is actually the issues related due to the COVID-19. We can see there are many of the suicide cases in Malaysia. We have seen the increasing numbers of the cases. There was an average of 4 suicide cases every day for the first 3 months of the year. So with 336 cases reported to the police. So this is the shocking statistic released by Health Director General Dr. Nur Hisham Abdullah, who said the number for the 3 months was more than half of what was reported throughout 2020. So the COVID-19 pandemic pushed the topic of mental health and also well-being support into the sharper spotlight in 2020, spawning a fresh wave of mental health challenges for numerous population. So mental health, the physiological and support service article. According to reports, the COVID-19 pandemic 2021 will have a significant impact on every mental health, including Malaysian. So some individuals are at a high risk of developing mental health issues. So such as a depression, anxiety when they are under intense stress and also isolated from their social support system. So, if this depression is not correctly diagnosed and also being treated fairly, it can increase the likelihood of the suicidal behavior. So, according to the sources from the Royal Malaysian Police, there will be an increase in suicide cases reported in 2020 from 609 in 2019 to 631 in 2020. As of March 2021, the Royal Malaysia Police had received reports of 336 suicides. Then this society is being asked to pay more attention to family members and others people so that they can spot early signs of depression that could lead to the suicidal behavior. We can see all this, the increased number, the increased percentage of the mental health and stress issues in Malaysia. So, okay, what is the library therapeutic landscape? It is derived from the theory of therapeutic landscape by Gessler. So, this therapeutic leads to the sense of non-treatment approaches used to help using the library's environment in the library. We're talking about the library's environment in the library. So, such as the dimension is such as the built or natural environment, social environment, and also spiritual environment in the library. So, it is to calm the mental, physical, and also spiritual aspect of the individual. So it also helps to promote a healthy lifestyles among the library's user. So this example can be seen during and also after the COVID-19 situation. So this diagram actually illustrates on how the public libraries support the health and well-being of communities from many aspects in the library services. So your libraries support the health and well-being of the communities from their information and resources and also and services. So the emerging methods are modifying traditional therapy. Therapeutic landscape show how place affects mental health. In a library, the goal is to ensure the product, the facilities, the information and resources, the services meet the user expectation. So in the library setting, studies on the therapeutic landscape quality are scarce. So incorporating a therapeutic landscape in the library, especially environmental aspect, may improve therapeutic satisfaction. So this therapeutic landscape measures libraries' users' satisfaction with therapeutic aspect of the and also element. So the study assessed library users' experience using natural and also the architectural settings, social environment, and also spiritual environment. So the study also discussed the library's position as an environment, not as a service provider. So the examination of a perceived library therapeutic landscape quality may reveal how users rate the libraries. The findings can be used to improve library quality attributes and the therapeutic landscape. This is according to the studies of the library therapeutic landscape from the aspect of the public library that done by the authors. So this is the model, and the concept is the model of library therapeutic studies in the public libraries. Is a places to promote health from the aspect of physical, mental, and also spiritual. This one by Husaini et al. At 2018. So from here, schools and also colleges have strengthened their well-being efforts and also programs in response to their rising prevalence and severity of mental health disorder among college students. Multiple campus entities include academic libraries contribute increasingly to the well-being of students. Well-being influence academic outcomes. Therefore, libraries adopt the well-being initiative to improve student education and also learning in general. So, library therapeutic landscape refer to the transformation of libraries into healing spaces, healing places. Okay, student health is enhanced by the therapeutic surrounding. So, the research described library therapeutic landscape for social well-being. The report also analyzed the trend and also provide recommendation for creating effective um, wellness initiative. So the AC, the studies actually concludes by describing library therapeutic landscapes measures to increase student social well-being. Okay, for the studies before, it is to measures the aspect of library therapeutic landscape quality towards the library therapeutic satisfaction. But the current studies is to measure related to the students' well-being by using the theory of library therapeutic landscape. So herewith is their problem statements related to the study. It is also discussed about the issues of the COVID-19, about the quality of life, about the post-pandemic issues related to the technology readiness, and also related to the social well-being. So the pandemic in 2020 have changed the social norm not only in the society but also in the library. So due to the pandemic of COVID-19, studies show the increased internet use among the society. The technology shows the play an important role. This is because of the changing of the working norms. So people are working from home, remote working, and the society culture have transformed into digital transformation. Besides that, due to the pandemic, the numbers of employment also increased. So the social depression and anxiety happen among the community, in the society, and also universities. So it's happened everywhere. Okay, even after 3 months of the pandemic, people are still remotely working from their home place. So understanding the library service mechanism involved at the community level, which will yield beneficial social well-being outcome. So this is the transformation of libraries, which is libraries become as a second home, libraries as a learning center, library as a meeting place, libraries as a recreational center, and library as a human development center. Okay, the academic library can be considered as a place that supports social development, looking at its role that enhance the qualities of life, enrich the individual learning, enhance the quality of lives, and also provide leisure and also recreational opportunity. So the role of academic libraries in the society development will be more visible and also significant with the qualities of library therapeutic landscape that can assure the library social well-being among the user. So these are from the aspect of the quality of life. And this is the post-pandemic COVID-19, the influence of library therapeutic landscape to students' social well-being. This is the part of the dimension or element and also item that involved in the that derive to the propose of the concept of the conceptual frameworks. So under this study, this is the proposed conceptual framework for the influence of library therapeutic landscape of student social well-being, where we do have the library spiritual environment, and then we also do have library social environment and also library natural and also built environment, and we are going to measure with the social well-being of the library user, especially of the students. So as this is the research methodology, as for the study, researcher adopting the pragmatism as its research paradigm. Those in study engage both methods of qualitative and also quantitative research approach to addressing the research question. At the first level, we are going to go through the qualitative levels, and later on we are going to come up with the quantitative approach. Okay, this study actually produced three major contributions for the communities, including the providers as well as researchers and also practitioners in general. So the instrument developed in the study can either replicate in a different setting, focusing on the therapeutic landscape quality and also the corresponding determinants. The study proposed a three major contribution for the communities. The instrument developed in the study can be either replicate in a different settings, research setting, focusing on the therapeutic landscape quality and also the corresponding determinants. So step by step guideline for the customer-centric services. And then it can also become a guideline as a policy maker and also strategist construction, informed decision for the librarians to develop their policies, training needs, library guides, and so on. As for the conclusion, so libraries should use social medias and also website. With the library's therapeutic landscape, academic libraries and librarians aspire to identify a useful library service that will benefit library customer. So according to the study, the public library, according to the previous study, the library is a second home, learning center, meeting place, leisure center, recreational center, and also human development center. So the wellness library service. So in this study, the researcher investigate the library's facilities and also services which contribute to students' well-being. Especially focusingly on the academic library, special collection of leisure from the aspect of the collection materials, locals and mental health information such as library guide to wellness information, example of library services that could enhance student well-being. So the library should be able to contribute to the individual and society beyond its collection, event and also activities. So in this epidemic, libraries must go digital. Social media becomes a vital aspect of library services once presented to students and also other library users. So internet is the last forum for students participants. Even though everyone may require time to adjust, the new standard will prevail. Not all treatment exercises are beneficial since students' experience and sensations are varied. So many use different tactics and also environments to stay healthy. So libraries are a simple example of the therapeutic landscape. That's all. Thank you. Assalamualaikum.